Hello everyone. Today we are going to talk about hypertension. Blood pressure is the force exerted by circulating blood against the walls of the body's arteries, the major blood vessels in the body. Your blood pressure fluctuates throughout the day as a result of your activity. Having blood pressure readings that are regularly higher than normal may lead to a diagnosis of high blood pressure. Hypertension is known as a silent killer. Most people with hypertension are unaware of their conditions since there are no warning signs or symptoms. After watching this video, you'll be able to understand everything related to high blood pressure, its causes, how to diagnose it, and the available treatments, as well as how to avoid its dangerous complications. Our role today is to answer most of your questions regarding hypertension. Today we have Dr. Im Pyo, who is a leading doctor at Hanyang University Hospital. He's going to discuss with us everything about hypertension from an experienced medical point of view. I am Umay. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Good afternoon, Dr. Lim.
Hello.
Nice to meet you.
Nice to meet you too.
So, Dr. Im, hypertension. Let's talk about it. What causes high blood pressure?
There are a lot of causes to hypertension, from genetic to environmental factors. We can't control the genetic factors, but if we pay attention to the environmental factors, hypertension is treatable. For example, weight gain or consumption of salty food, or smoking. All contribute to hypertension, and controlling these is the biggest goal of treating hypertension.
So what is the difference between systolic and diastolic?
When we talk about blood pressure, there are systolic and diastolic blood pressures. So these two pressures, if you allow me to explain. Systolic pressure is pressure during the heart's contraction, and diastolic pressure is pressure felt during the relaxation of the heart. There are certain criteria. We define hypertension as when the systolic blood pressure is above 140 mmHg, or the diastolic blood pressure is above 90 mmHg. And the modern trend focuses on lowering the systolic blood pressure.
So what is considered a normal blood pressure?
So about normal blood pressure, standards for blood pressure have been constantly changing from the past. As of now, normal pressure is defined as systolic blood pressure under 120 and diastolic blood pressure under 80 mmHg, while high blood pressure is defined as pressure above 140 to 90. The current trends are lowering this threshold, so the question is, what should be the target blood pressure for hypertensive patients undergoing medical treatment? This has been the focus of various researchers. For now, the target is to lower systolic blood pressure to 130 and diastolic blood pressure to 90.
Okay. What are some other health problems that are associated with high blood pressure?
There are no symptoms to hypertension, so it is understandable when people ask, should I even treat this? But it is a accumulation of effects that is important if symptoms do present due to underlying hypertension, as it causes damage to our body. This could be potentially fatal. A common example would be when uncontrolled hypertension leads to stroke or cerebral hemorrhage. The complications arising from stroke or cerebral hemorrhage are just too severe, which is why it is important to prevent them from happening through active blood pressure management. One more thing to add is that when there is a problem with the heart attacks, or as I will illustrate later, heart failure can occur. This can cause you to be out of breath, with minimal movement or not being able to lie down straight. These types of deleterious effects occur, and when they do it, it is an irreversible defect, which I can safely say has severe impact. So it is important that when you recognize you have high blood pressure while you were still healthy, even if there are no symptoms, it is important to manage it accordingly.
Okay, so you said there are no symptoms to high blood pressure. So how do I know if I have high blood pressure?
In the case of Korea, there are regular checkups. Most workplaces provide it, and international guidelines also recommend regular blood pressure measurements over the age of 40. There are no symptoms specific to blood pressure, which means you don't know you have high blood pressure if you don't measure it. So it is important that you measure your pressure when there is an opportunity and measure it accordingly multiple times. If possible, get an automated blood pressure monitor in each house and make a habit of accurately measuring your blood pressure repeatedly.
So for the treatment of high blood pressure, Are drugs the only option for treatment?
Oh, no. Of course not. If you are diagnosed with hypertension, the first treatment is not using medication, but lifestyle modification. If you are smoking, you should quit. If you are overweight, try to lose weight, and other aspects such as if you are eating your food too salty. You should pay attention to this too. And then there's the option of using medication. There is a diversity of medication, and you should choose the combination of these drugs which fits you. In less than 10% of cases, blood pressure is not controlled even under medication. In those cases, tests are taken to identify refractive hypertension, and some patients have a specific cause for hypertension. For instance, a tumor that raises blood pressure or the narrowing of vessels leading to the kidneys. We look for these causes, and if they do exist, medication is generally the treatment, and if the patient refuses medical treatment. Recently, there are procedures called electroablation, where we sear the renal vessels to lower the blood pressure. But generally, the first step treatment is lifestyle modification, and the second step is medication.
So in the case of the patient who needs to get the drugs, are there any side effects of the drugs?
Side effects are variable for each medication and situation. For example, pregnant women should not be taking certain anti-hypertension medication. Some drugs cause constipation, some cause headaches, while others slow the pulse. These are diverse types of medication, and its effects vary with each individual. So it is important to select the medication that suits each patient well.
I know you talked about it before, but can you speak in more details about the kind of diet that should be followed in case of high blood pressure?
Diet is extremely important. The well-known DASH diet is a great example, but it is very hard to commit to it every day, and in general, which is why I tell my patients to eat as blandly as possible, with minimum salt. This is the most important in controlling blood pressure.
Are there any type of drugs that cause high blood pressure? That could be the cause of the high blood pressure?
Oh yeah. Certain drugs can contribute to higher blood pressure. A common example would be the common painkillers. Painkillers can cause high blood pressure, and then there are steroids. Steroids, taken for some medical reasons, over an extended period of time, can raise blood pressure. So be aware if you are taking painkillers for a long time. Another possible cause of blood pressure elevation is for people who have sleeping disorders, called sleep apnea. This is known to raise blood pressure.
So doctor, I know you deal with the patients every day. How common is blood pressure in Korea?
The prevalence is proportional to the age group. Statistically in Korea, 40% of those in their 40s, 60% of those in their 60s, and 80% of those in their 80s have hypertension. And women generally don't have hypertension until their mid-40s, but the prevalence curve steepens after menopause. While for men, the curve is more gradual, so elderly women in their 70s and 80s have a tendency for higher prevalence of hypertension. Not only in Korea, but globally.
Is there a way to prevent high blood pressure apart from the diet that we talked about before?
Well, first, avoid gaining weight. Second, not smoking. These two would be the most practical and important.
So people who have high blood pressure, are they more likely to have heart attack, for example, or any cardiovascular disease?
Hypertension is the biggest risk factor for cardiovascular diseases, such as heart attacks. Worldwide, it is known to contribute to 20% of all cardiovascular deaths. And it is true to this day that many people do not even recognize that their blood pressure is high, and even if they do and receive treatment. The treatment is often inadequate. Blood pressure control is still one of the biggest concerns shared by medical personnel worldwide.
Today, the doctor explained in details everything related to hypertension, including its causes, symptoms, and how to avoid its dangerous complications. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.